But women who have family history or in whom we know there is a mutation in the gene like BRCA1 or BRCA2 gene, their risk for breast cancer, lifetime risk, could be as high as 70 to 80%. Moreover, the risk could start from as early as when they're in the early 20s.
So today we have with us Professor Rajiv Sarin. He is officer in charge for Cancer Genetics Unit at ACTREC and senior consultant radiation oncologist at Tata Memorial Hospital. It is my pleasure to have you over here, Dr. Sarin. Thanks for joining us for this event.
So, Thank you, Ms. Payal. Yeah.
I have a few questions on genomics for you, and for the one that half of India has learned from, especially genetic counselors like us. So, in this event, we have been speaking to a lot of oncologists, and we've heard that women should start clinical breast examination and mammography from age 40 and breast self-examination from as young as 25. But what I wanted to ask you is, does cancer screening change for someone with a family history or a known BRCA mutation?
Yeah, I think that's a very important question, and things to distinguish. The type of screening, the frequency of screening, and the age at which you start screening depends upon what is your risk for cancer. So there are two kinds of, one is a population risk of cancer, and the other is high risk, means higher than the population or the average risk for cancer. So for what you described is for those who are at population risk of a particular cancer, like say breast cancer. But women who have family history or in whom we know there is a mutation in the gene like BRCA1 or BRCA2 gene, their risk for breast cancer, lifetime risk, could be as high as 70 to 80%. Moreover, the risk could start from as early as when they're in the early 20s. So keeping that in mind, if they wait till the age of 40, almost 1/3 of them would have already developed breast cancer by then. So we start screening for them at a much earlier age, from the age of 20 to 25, the other thing is, because when we are screening a younger woman, say at the age of 25, the density of the breast as seen on the mammogram is more in a younger woman because it is more of the milk glandular tissue as opposed to fatty tissue in an older breast. So on a mammogram, it looks very dense. You see more of white, and a small early cancer may be missed on that. So it has to be done. The mammogram has to be of good quality, high quality mammogram. If it is done, it has to be read by a person who's expert. And actually the best way in young women, very young women, is doing a MRI, and not just any MRI in any place. It has to be done with a dedicated breast coil. And the doctor, radiologist who's reading the MRI of the breast has to have experience in reading the MRI of the breast. So that is for the screening of, so it starts early and has to be done including MRI, and sometimes alternating MRI with the mammogram. And some women feel that just doing ultrasound alone is sufficient. Ultrasound, if someone has a lump, just try to see what kind of lump it is, then you can do ultrasound. Otherwise, doing ultrasound alone is not really sufficient. So that is for breast cancer. For ovarian cancer, the other cancer which is more common, almost 1 in 3 women who have a BRCA mutation or maybe higher than that will develop ovarian cancer. But the screening methods for ovarian cancer are not very sensitive. These are sonography done internally, transvaginal sonography, and the other is a tumor marker called CA125. But they can miss early stage 1 or early stage 2 ovarian cancer, so it is not reliable. And that's why we directly suggest women to have, if they have a BRCA mutation, to have a risk-reducing surgery to remove ovaries and fallopian tubes.
This was helpful. So my second question is, does all rare cancer need to be tested for a genetic test and or somatic test?
Not all rare cancers, but there are particular type of rare cancers, like certain types of brain tumors. Someone has a choroid plexus, carcinoma, or a particular other type of childhood cancer, like say adrenocortical carcinoma, or particular embryonal rhabdomyosarcoma, or medullary thyroid cancer. So some of these type of tumors, we know that if someone has this kind of rare tumor, there's a high chance that it is because of a mutation in the gene which they're born with, and that's what has caused them to develop this cancer. So for them, yes. But more importantly, amongst the common cancers, such as breast cancer, ovary cancer, colorectal cancer, these are common cancers. But in them, not all of them, but there are particular histological types which the histopathologists will write in the diagnosis. Sometimes the doctors will ask for special tests, like a triple negative type of breast cancer. Or amongst ovarian cancer, it's a high-grade serous ovarian cancer. Or in the colorectal cancer, when the pathologist writes MSI high, microsatellite instability high. So these patients require germline genetic testing to see if it is an inherited risk. And many of these tumors, including lung cancers and prostate cancers and other cancers and GI cancers, you may want to do somatic, which is in the tumor cells. You want to look at the mutations in the tumor cells, genetic mutations.
Thank you so much. And so my last question is, any other message that you have for us women on this International Women's Day?
So, I mean, for this International Women's Day, I have just, one or two simple messages. One should not advise women, but still. So one is that adopt a healthy lifestyle. And that is easier said than done. First of all, how do you define lifestyle? It's very difficult if you decide, but everyone knows in their heart what is a healthy lifestyle, what is a good lifestyle. So I think everything in moderation. I mean, you live only once, so you have to enjoy life, but you have to see that your diet is balanced diet. You have more of fresh fruits and vegetables, not some exotic fruits and vegetables, but seasonal fruits and vegetables. And a diet, if you are putting on weight, you know that your diet is not good for you. So your weight is basically a balance between your diet and your physical activity. So good physical activity, weight is maintained, sleep cycle is good. It should not be irregular sleep cycle, because there are many women these days who are having menstrual problem, PCOS and other problems. And a lot of it is because of lifestyle. So healthy lifestyle is very important. In many ways, it protects not against just cancer, but many other lifestyle related diseases. So that is one thing. Now coming to cancer in specific, be aware of your age specific cancer risk. Like if in absence of a family history or a gene mutation, a 25-year-old lady, her risk of breast cancer or cervical cancer is very low. But a 55-year-old woman, her breast cancer risk is higher because age is a risk factor. But if there is a family history or something else or other personal risk factor, then in that case, your risk may be high. So you be aware of it and then take appropriate action. For most of the conditions, now we have guidelines to what kind of screening should be done, what kind of test, at what interval. And the doctors are expert now in interpreting these tests. So that is to be done. So appropriate for the age, the sex, whether you're a male or a female. Of course, here we're talking of only females on Women's Day. And based on the risk factors, screening is to be done, and screening should be done in a center where it is done well. There's no point just doing it and just ticking the box if it is not done well. And more importantly, women should follow up on the test results, and it is not just doing once because someone told you, or there was a camp, going on the Women's Day. Many times people do that. There's bus, moving vans and all. But it should be done on a regular period, and make it a habit, maintain a diary and remember and do that. Cancer, which is detected in a very early stage, not only it saves your life, it saves you a lot of hassles. The treatment intensity is generally much milder, and the chances of you surviving that cancer and without much of problem is much higher if it is detected early. So all the best to all the women. I hope none of you ever develop cancer, but if you do the screening, if you lead a healthy lifestyle, the chances of you developing cancer and advanced stage cancer is much, much less. Thank you.
Thank you so much, sir, for sharing this pearls of wisdom and joining us on this session.
Thank you. Thank you. Bye-bye.